Hey everyone, happy August. I hope you're enjoying the hot weather. So today we're just going to quickly talk about a couple things. The first thing is every year you guys should be doing the CDC yearly checklist. So that is in the portal. There's two parts to it, the way the CDC split it up twice, so we split it up twice. So there's sort of an administrative part and then more of a clinical part, but you're supposed to go through that, fill that out every single year. It's pretty easy, but if you need help with it, as always, feel free to reach out and we'll help you out. Then the second thing we're going to talk about today is a little bit more involved, and it is radiology safety. So a lot of states require radiology safety and training every single year. And it also, some of it require it kind of outwardly, and then some of them sort of embed the requirements in the radiology protocols. So today we're going to go over radiation safety. So first of all, as we all know, films are safer than they've ever been, right? We have digital films, the way that the scatter radiation is, it's less, everything's safer than it was in the past. But still, it's radiation and it still could eventually, potentially cause problems. So we're going to go over some radiation safety things. So the basic goal, obviously, is to reduce radiation exposure to you as the operator and to the patient. So that's blanket rule, right? There should be a radiation safety officer in every office. Usually that's the infection control coordinator, the person that's in charge of that. It's that person's job to make sure the instructions for use from the manufacturer of the machines are followed, right? That should somehow be written somewhere and explained. They also want the actual instructions somewhere in the pamphlets for the machines to be available if someone has questions about it. You should be monitoring, this radiation person should be monitoring the performance level of the machines. So that's kind of checking around and making sure they're doing what they're supposed to be doing, monitor safety, making sure patients or where they're supposed to be, team members are doing some of the things we're going to talk about in a minute, making sure they're following the right protocols. And then the big thing is this quality insurance program. So that is a regular sort of checking of things. You guys have your machines calibrated, hopefully on a regular basis. Some states have no recommendations or no sort of definitive dates, but most kind of say 4 years is, too long to go without calibrating them. A lot of states have specific requirements. So usually it's one every year, getting your machine calibrated by an outside medical physicist for a CBCT. And then for the regular machines, like a tube head or a Nomad or something like that, it's once every 3 years. So this person, the radiation safety officer, would help keep records of that, make sure that that's happening. As you guys know, you tell us the date that you do it, and we're going to put it in the calendar 3 years, 1 year ahead to help you remember that. So, some of this we can take a little bit off the plate of the radiation safety officer. But quarterly, ideally, this person should be kind of checking things, and definitely after someone comes and fixes something. So if you have someone that's a machine that's broken or there's a calibration or whatever, you want to double check and have this person check afterwards. Another thing is monitoring the office's film repeat rate. So that's kind of keeping track on how many repeat films you're doing, and if you're doing them, why, right? Does it involve that there's more training that you should be doing with the team on how to position films, what types of films you should be taking, what settings it should be put on, all that stuff. So if you're having a ton of repeats, then something needs to be addressed. This person is also checking to make sure, we all know all the tube heads, you pull them and then they kind of move around a little bit, but helping to make sure that doesn't happen, because obviously you're going to take more repeats or films are not going to be as clear if that happens. Inspecting lead aprons. You're supposed to look at the lead apron. You don't have to take a film of it or whatever, but unless you see a spot. So if you see something that looks a little funky, that's when you would take a film of it and see if it's, solid there or it needs to be replaced. And then obviously everything's written down, right? This person's maintaining the inspection records. If there's a new person that comes along, they educate them. I'll tell you what that involves. And then, providing like some kind of continuing education, offering not necessarily for credit, but just sort of explaining to the team what the things are. Also, this person makes sure that the notice to employees, which there should be in the portal for you guys under your state, if you don't have it, it basically is just piece of paper that says that, warning, there's x-rays and this is what you can do if you're worried about it. And, this is how you handle it. Also, the approximate number of exposures in each operatory per week is something that you're supposed to sort of have a handle on. Making sure the warning labels are posted. So if you don't have warning labels, I have given you guys a bunch of those little yellow labels. They should be posted somewhere. If not, call me. And then again, just making sure the calibrations are done at the right time. So we all know there's two different kinds of dental x-rays, right? There's the extraoral, like a CBCT, PAN, SAF, that kind of thing. And then intraoral, so, the PAs, bite rings, that stuff. So anyone that is taking films obviously has to have training in it, has to have radiology certification. That's kind of a given. We're going to just assume that. But you want to teach everyone how to operate the machines safely. So the big thing is on all the machines, there's little pictures of little teeth and big teeth and, molars versus premolars and anteriors. You really want to make sure you understand what button to push for what you're taking, right? Because all of those things have different exposure times, different dosages. You want to make sure you're doing the one that's the minimal for what you're taking. And I know that some people leave it on a certain setting, but if you're on a molar setting and that's going to give you a little bit more exposure and you're doing, some anteriors, it's a good idea to change it to the right kind of setting. Another important thing is make sure the patient is properly positioned, right? So you ideally, you want the patient as still as possible, right? You want to make sure, if your tubing is here, and the patient's down here and you can't get, you move the chair up to get the tubing where it needs to be, right? You want to have the patient, that's your chair's move, right? You want to put the patient exactly the best spot for your tubing. When you take a film, you want to make sure that you can see the patient, hear the patient, but be out of the room. So it is important to be behind some sort of barrier, at least 6 feet away from the patient, but you do want to be able to have some sort of contact with them in case there's an issue or something goes wrong. You want to not hold the film for the patient. We'll talk about what that means if you do hold a film, but you're not staying in the room with the patient. Also the source to skin distance. So that's the distance from the source to the skin. You don't want it to be less than 20 centimeters. So that's important. And then lead aprons and thyroid collars. So every state is different. You got to double check, see what your state is. But it's been shown basically that lead aprons and thyroid collars are not hurting anyone. A lot of, the ADA has stopped recommending them. A lot of states still recommend them or require them in their recommend words. So just find out what your state is or call us and we'll help you. But it's never, having a patient wear a lead apron or thyroid collar is never going to do anything wrong. All right. And then as far as you guys for individual monitoring or dosimeters, you're supposed to have less than 1 millisievert dosage per year, right? The average dental worker gets 0.06 millisieverts, which is 6% of the minimum dose that they want you to have. So being a dental worker, it is very difficult, or you almost have to try to get more radiation exposure. So that it's good from our perspective, right? So we are definitely not near the threshold at all. 6% is not at all near the threshold. You all know you can get radiation from everyday stuff, probably more than you're getting from work. But if you're pregnant, you're supposed to wear a dosimeter. You're supposed to wear it kind of near your waist, right? And you are supposed to wear it throughout your whole pregnancy. So if you're pregnant, you do tell your people that you're pregnant and wear a dosimeter. If you are expected, like if you think like that your limits are close to this 1 millisievert, then wear a dosimeter. That's fine. It is kind of a guideline to kind of have someone wear a dosimeter every 3 to 5 years for about a year. And that kind of gives you a baseline for your office. And honestly, as I've said to a lot of you, I've never seen anyone get really high readings on it. So it kind of gives you a little reassurance. So as I said, the lead aprons, you got to protect, you got to check with your state. The big thing is the handhelds. Most of the handhelds will say that if you can't maintain exactly how they want you to position it and you can't have the distance that they want, you have to wear a lead apron. And it's very small in their fine print. I just read it in the Nomad fine print, but besides that, many states, for example, Massachusetts requires that any operator of a handheld wears a lead apron with a thyroid collar. So just kind of keep that in mind. All right. And then patient safety, right? Because we're concerned about the patients too. So pregnancy, first thing you do, you find out if your patient's pregnant, right? If they are pregnant, you ideally want to only take films if necessary, right? If medically necessary. And that would be a patient that the ADA still is recommending that you put a lead apron on. Even though they've nixed the lead aprons, they're saying for a pregnant patient, probably a good idea to put one on. And then you want a LARA, which is basically as low as reasonably achievable for films, right? You want the patient to get as minimal radiation as possible. So the dentist, the team, everybody should make a good faith effort, do an examination, check the caries risk, decide when the person needs films. Really important to do that. You don't want to take too many extra films. You should also, the big thing is make sure the benefit of taking the films outweighs the risk of taking the films. And most of the time with dental films, it does, right? Taking routine films, making sure that there's something not going on under the hood, that you can't see does far outweigh not taking them. Then the image settings, as I said before, the little settings that are on there, you want a minimum of 60 kilovolts and not more than 80. So you want to make sure that you're in that range of the button that you're pushing. You most likely are. And then you are supposed to have the little chart there. So most of the machines now have a chart sort of on it. But if it doesn't, you should make a little chart if you can change the settings in it and make sure everybody understands. So maybe after this, go around your office and say, hey guys, for bite wings, we push this, for PAs, we push this, anteriors, posteriors, whatever you're doing, go over and just kind of make sure that everybody knows what they're pushing for your specific brand of x-ray. Then obviously, if you can use digital films, so much better than using, film-based. I think we've all kind of moved to digital films. So the x-ray beam that should be collimated, right? So there's two different kinds of collimation. There's cylindrical collimation, which is like, it's a circle, right? So the tubing comes out in a circle. There's a chance for a lot of scatter. They really want you to do rectangular collimation, which is sort of this rectangular device that would go into the tube head. And then that makes it so it's almost if you were to put the tube head here, it's bigger than the film, but it's so much less radiation. So that is recommended as much as possible. The thing about that is obviously you have to be really good at taking films, right? So it does require, it has a little less, give there, right? It requires you to be able to really, put the film where it needs to be, which is why it's good to have the position devices, like the RINs and stuff, to really get the film where it's supposed to be, keeping the film still, all those things. So having holders are, a great idea for and having rectangular collimation, they really want you to do that if possible. So proper, and then the other thing is proper seating of the patient, proper positioning of the sensor, proper positioning of the tubing, all that kind of stuff. The more that you practice and make sure that things are right, the better off you are. So if you see someone in one operatory that's always kind of taking films that are really overlapped or aren't diagnostic, it's a really good idea to go over it and really, how are you taking these films? Show me how you're positioning the patient. Show me how you're positioning the tubing. Show me how you're positioning the film. All that kind of stuff. Very important. Okay, so lead apron disposal. A lot of people have asked me about that. So you are supposed to dispose of lead aprons if they get cracked or ruined, or if you're not using them anymore. You can recycle them you can call like a metal scrap recycler. You can call the manufacturer you got it from. You can call someone that sells x-ray supplies. You can call your town, and a lot of towns have landfills that you can put in hazardous waste. But you should call and find out if that's okay. You can send it to like a hazardous waste company, send it back. There's a bunch of different ways to handle it. The handhelds, we're just skipping around here. A handheld device is really important to know how to use it, right? You have to make sure that plastic thing on it, the backscatter shield, is not broken, is always where it needs to be. You have to follow the instructions. You have to have an FDA regulated, approved handheld. And the other important thing about a handheld is because it is portable, you want to lock it up or have it secured somewhere so that somebody can't just come in and be like, oh, we're going to take x-rays of everything, right? So you have to make sure that it's somewhere that it's secured when not in use. That's a big thing about it. Then you want to make sure that the operator stands at least 2 meters. I'm going to go 2 meters away from the tube and from the patient. If you can't, this is another little fine print thing. It tells you you have to wear a lead apron with a thyroid collar. So another thing too is 6 feet radius. So you want 6 feet around the handheld that nobody is in that zone. And if anybody's in that zone, that person's wearing a lead apron with a thyroid collar. Got it. All right. Then the last thing we're going to talk about radiation is if somebody needs to hold the film for someone, you have to document it. That person has to wear a lead apron with a thyroid collar, and that person is going to document it and really try to keep that stable. And you want that person out of the main beam. So if you have the cone here, right, you don't want that person to be right here. You ideally want them to be holding it from a distance, and then keeping it, really secure. So that would be like if there was an older person, if there was a kid, if there's somebody who can't hold the film themselves. That is radiation safety. But the most important thing, my favorite thing, documentation, right? You have to document all of this, right? Who was here? Who listened to this? Right, that you did radiation safety and the date, right? Always document it. It's every year you're supposed to talk about this. So any questions, as always, reach out, enjoy your CDC checklist, enjoy your radiation safety, and enjoy the rest of the summer. Thanks.